Me mamunyina ha ma mo akwaba eba UTV so ye wo abeka janship house e won kran ye pram to breka se boy saka fi o mamu ene amanone ene yaso no so ye de ebremu na kase bodi bedi mu akotene bi ene se Covid-19 yare ese so man Ghana akakakra bi na nipa wo mo anya bie no eye empim edu emienu wo mo ewu no nso ekwa anim ye pa sanso ene ye behwe se mampanyisha wa hye se fisa bere ko no wo bepia bonte awon hye sa nose mask ni bi no watomra no yebedi ho enkomo na fe ya hwe se yesuafo a ewesuapo ahodo a enne omahase ko school no etisen mantam ni nyina no school fo nkwada na eko na niam eko sen wo ho yede ho nkomo twetwe bi behye so arho se bi esakafi morey ene se abaya wonye fiedu baako apadie kurutu nyuma yede na yentini wabubu eba ne sen yebedi ho nkomo papa pesan sa yere ho sam na fia komo no ni nsem mu yebeko Indian Covid-19 yi no yebetu asisu dua sa Indian man mu no akosora ma bibia de wo manya bi ne beda na yasem na okwan ben so na panyifo ye apa baby ama wo manya yare bi no ombekọ akokoda we ni sama wodo bebre na bra so se me agya kwabena me de bram na mu no mu ka me ho ne fasida piesie ema best point saving saloons best assurance this way chocolate drink and the coffee drink this way non-dairy tea creamer and milk powder wo kwa so be pe this way for milk powder ni bi ahoden ko a special ice nso krojin a wo no ma hoden wom de otom de osachet mu nyinara special drink no so favors ni makomako anson na special energy drink anu no ma carry fi no wanya hoden watumi aye adwuma you too enchene and feeding to full liter be kwan a ye de prekese awo no bi o ye de kwan susu anso na awo no wodi ahoden ko ansa nyuma koyi ni kura memu ama me de kasebo no ebrem afrika sebo no emu ensem nie sede afibia na sebribia ye mampani eye no aya na uma no de betu ye nim ni akasa afa Covid-19 yare no bebia ekọ no bebia eduro na enra wone ye kasae na mampani kasa no chirichirimu ese sese no Covid-19 ni panya bi o manga na mu no aye empim do baako ahankono adusia nan 11964 na chese aka nipa beye aduasansia na enya empim du mienu 12000 na nipa o mo hoto mo eye empim nan ahanu ne aduonum anwotwe 4258 mampani sanchiremu se woma ahwere omo enkwanom eye aduonum enan na fe so na chese yare ne sede ebae na se nipa beye ahanum aduana mienu 554 na britia bi no omasan ababeka ho na mampani kasa no wo kiremu ekwakire ye se yare no asetera na etere enti ho behia se hihya wo de egu akwamu se na be yade yi yebetumi atuso sa anase asenkotere bebre no Ghana fo emfa na semhia ne emfa nya adwuma.
Ghanaians, I have to address a matter which has to deal with our case count, especially in recent weeks, and which has given cause for anxiety. The increase in numbers indicates that the virus has spread and continues to spread. We have to bear in mind at all times that the more people we test for the virus, the more people we are likely to discover as positive, and thus have the opportunity to isolate and treat them. If we do not test people for the virus, we will not find the persons who are positive, let alone isolate them from the population and treat them and prevent them from spreading the virus. For example, the total number of tests that we have conducted in Ghana, with a population of 31 million, 254,331, is one of the highest on the African continent. Furthermore, many countries in the world, including several of the developed economies, are not implementing a policy of enhanced contact tracing. And this makes our data qualitatively different and more effective in the fight against COVID-19. Indeed, the success of our tracing, testing, and treating will lead, in the end, to a reduction in the number of cases. That is what we're working for. Understandably, much focus has been placed on the rise in the total number of confirmed cases. As at midnight of 13th June, the total number of positives cumulatively stands at 11,964 out of the 254,331 tests conducted. We have a total of 4,258 patients who are fully recovered, have been discharged, and are now free of the virus. So our scrutiny, in effect, must be on the number of active cases, i.e. people who remain on our books as still positive. Hence, as things stand now, the total number of people with the virus, that is active cases from our tests, is 7,652. Our positivity rate, i.e. the ratio of positive cases to total tests conducted, stands at 4.7%. In our hospitals and isolation centers, we currently have 13 persons severely ill, 6 persons critically ill, with 3 persons on ventilators. Mercifully for us, by the grace of God, the number of COVID-19 related deaths, sad though each death is, continues to remain very low, one of the lowest in Africa and the world. With 54 deaths currently reported by the Ghana Health Service thus far in Ghana, the ratio of deaths to positive cases stands at 0.4%, compared to the global average of 5.5% and the African average of 2.6%. The number of severe and critically ill also continues to be low. I am relating all these figures not to engender any false feel-good factor, but as statements of fact that must provide the context for us when we examine our figures.
Wasansam kuro yi